So hey everybody, I'm just sitting here watching the game, like game 6 of the NBA Finals, and we are in the third quarter, 2 minutes and 22 seconds left, and KLAY Thompson injures himself. He has injured his knee. He went up to dunk the ball, and as he came down, he landed at an awkward angle, so his center of gravity was back behind his foot, and his momentum was continuing past his foot. And if you watch any of my other videos on ACL injuries, you know that this is an ACL killing position unless proven otherwise. We can see the valgus deformity of his knee when it opens up, and at the very least, he's injured his MCL. Hopefully that is all. He grabbed his knee right away. He had difficulty walking off the court. He had to be helped off by 2 of his teammates. And I suspect that he may have injured his ACL ligament. That's unfortunate. Things are not going too well for them. KD last game and now potentially KLAY Thompson this game. So we'll have to see what happens, and we'll have to watch for social media to see if they say exactly what the injury was and when he's able to return. But if this is an ACL injury, then that's quite unfortunate, and he's gonna have to go on to have surgery and then rehabilitate from that, and it may be up to a year before he returns to the game. So interestingly enough, KLAY Thompson just came back on the court. He was helped off the court and he went to the locker room, and then in less than 2 minutes later, he came back. He kind of limped back. He was trying to hide it, but he actually came back, and then he took his 2 foul shots. And you could see that after he turned around after the foul shots, he was trying to run up the court or jog up the court and not make it look obvious, but he was limping. And then so immediately thereafter, his coach called a timeout, and they subbed him out, and then he immediately went back to the locker room. So depending on what injuries he's had, then he may be able to walk initially. He may not have swelling initially, and then over time his knee will become progressively more swollen and progressively more stiff. If he tore his ACL, then there would be bleeding in the knee immediately, and initially he would be able to walk. He would have pain initially, then there would be a brief period where there was not any more significant pain, but as his knee became progressively swollen more and more with blood, then the pain would increase again and he would have difficulty walking and bending the knee. If on the other hand, he injured his MCL, this would be immediately painful and would continue to be painful as he moved his knee. And finally, if he injured the meniscus only, then he would have some pain initially when he had it, and then it would probably go away and he would be able to move on it unless it was a locked meniscus. And the swelling would be a little bit more delayed than it would be with something like an ACL injury. And at any rate, he's now back to the locker room. I'm not sure what he has. We'll have to see what they say on social media and whether he's able to come back if there is another game or come back even in this game. But I think for today he's done, and we'll just have to follow the story and see what happens.